Hi everyone, I am your instructor Dr. Junaid, MD. Today I will discuss about the anatomy of prostate gland, its structure, function and clinical importance. We will look at where it is located, its blood supply and nerve supply, the different zones of the prostate and finally its clinical significance including benign prostatic hyperplasia and prostate cancer. Starting from the overview, the prostate is the largest accessory gland in the male reproductive system. Its main function is to release enzymes that keep semen in a liquid form, allowing sperm to move freely through the female tract for possible fertilization. Anatomical location: the prostate sits just below the bladder neck and above the external urethral sphincter. On either side lie the levator ani muscles, and behind it is the rectum's ampulla, which allows doctors to examine it through a digital rectal examination. Its secretions drain through the prostatic ducts into the urethra just before ejaculation. So this picture is showing the location of prostate gland. As you can see that it lies just below the bladder neck and above the external urethral sphincter, and behind it is the rectum's ampulla, which is felt through which prostate gland is felt on digital rectal examination. Then we will talk about the structure of the prostate gland. The prostate gland is roughly the size of a walnut, made up of 2/3 glandular and 1/3 fibromuscular tissue. It is surrounded by a thin fibrous layer. Instead of using the old lobe model, clinicians now prefer McNeil's zonal system, which divides the prostate gland into central zone, transitional zone and peripheral zones. Peripheral zone makes most of the gland part in 65% cases, transitional zone 5 to 10%, and central zone contributes to 25% formation of the prostate gland. As you can see that in this picture, the red labeled area is the central zone, blue one is the peripheral zone, and green one is the transitional zone, and pink zone is the anterior fibromuscular stroma. This picture is also showing the zones of the prostate gland. As you can see that there is transitional zone behind the pre-prostatic sphincter, then there is fibromuscular stroma, and on the left side you can see peripheral zone, and above peripheral zone there is the central zone of the prostate gland. Then we will look towards the zones of the prostate in detail. First of all is central zone. Central zone surrounds the ejaculatory ducts and is less prone to urine reflux. The transitional zone encircles the urethra and is the main site for benign prostatic hyperplasia. The peripheral zone forms the bulk of the gland. 65% of the gland is prone to the inflammation and is most common site for prostate cancer. Finally, the fibromuscular stroma lies anteriorly and merges with the urogenital diaphragm. Then we will discuss about the lobes of the prostate gland. According to the older classification, prostate gland has anterior lobe, posterior lobe, median lobe and two lateral lobes, right and left lateral lobes. Mainly there is median lobe projection is seen in very huge enlargement of the prostate gland, and median lobe projects itself into the bladder. This picture is showing the lobes of the prostate. As you can see, anterior lobe and both right and left lateral lobes, and median lobe in the center, and back of the median lobe there is posterior lobe. Blood supply of the prostate gland. The prostate is mainly supplied by the prostatic arteries from the internal iliac artery, with the contributions from nearby arteries. Venous drainage occurs through the prostatic venous plexus, which connects with the Batson venous plexus. This connection explains why prostate cancer often spreads to the spine and vertebra. As in this picture, you can see that prostatic artery, which is branch of the inferior vesical artery, and inferior vesical artery is the branch of internal iliac artery. These arteries are supplying the prostate gland, As you can see that prostatic artery is giving branches to the urethra and prostate gland. And you can also see the branches on the left side, branches from the middle hemorrhoidal or middle rectal arteries and pudendal arteries, also supplying the prostate gland. In this picture you can see that the venous plexus, venous drainage of the prostate gland. As you can see, there is a vesical venous plexus and prostatic venous plexus, and both of these plexus drains the venous blood into the inferior vesical veins, which further drains into the inferior vena cava. This is the lymphatic drainage of the prostate gland. Prostate gland usually drains its lymphatic secretions into the pre-sacral lymph nodes and common iliac lymph nodes and obturator lymph nodes, and from common iliac lymph nodes they drains into the para-aortic lymph nodes on the right side and paracaval lymph nodes on the left side. Then we will discuss about the nerve supply and neurovascular bundles. The prostate receives sympathetic, parasympathetic and sensory innervation via the inferior hypogastric plexus. Sympathetic fibers stimulate smooth muscle contraction during ejaculation. On each side of the prostate lies neurovascular bundles which carries nerves and vessels to the penis. Damage to these during prostate surgery can cause erectile dysfunction, although nerve sparing techniques may help to preserve the erectile function. As this picture is showing the nerve supply to the prostate, as you can see that there is both sympathetic, parasympathetic and sensory innervations via the inferior hypogastric plexus to the prostate gland can be seen in this picture. Clinical relevance. Point of clinical relevance include benign prostatic hyperplasia, which is benign enlargement of the prostate gland. There is usually enlargement of the transitional zone of the prostate. As the prostate enlarges, it compresses the urethra and causes urinary retention and lower urinary tract symptoms like weak urinary stream, hesitancy and incomplete emptying. While not cancerous, it is very common in older men and can significantly affect quality of life. As you can see in this picture that there is on right side you can see the normal size of the prostate, which is about the size of a walnut, and urine is passing freely through the bladder, neck and prostatic area and then traveling through the urethra and getting out of the body. While on the left side you can see the enlargement of the prostate, which is compressing the way and urine. There is significant obstruction of the urinary flow, which can result in lower urinary tract symptoms or sometimes acute urinary retention. Then second point of clinical relevance include prostatic carcinoma. The malignant cells commonly originate from the peripheral zone, although carcinomas may arise from the central and transitional zones too, but these are rare. Mainly prostatic carcinoma arises from peripheral zone. Proximity of the peripheral zone to the neurovascular bundle which surrounds the prostate may facilitate spread along perineural and lymphatic pathways, thus increasing the metastatic potential of these tumors. A digital rectal examination may reveal a hard, irregular nodular prostate gland with upper limit possibly not reachable, and the overlying rectal mucosa may be fixed, and there will be the nodular surface of the prostate gland felt on digital rectal examination. Then there is a test which is known as prostate specific antigen. The prostate specific antigen is an enzyme which is a serine protease secreted by the prostatic epithelium, which aids the liquefaction of the ejaculate by lysing seminal vesicle proteins. Increased levels of serum PSA may suggest the presence of prostate cancer, but in other conditions there are various conditions in which serum PSA level can be elevated. These conditions include like prostatitis, cause acute inflammation of the prostate, like severe constipation, extended sexual intercourse or catheterization may also increase the serum PSA levels. So it is not highly specific to the prostate cancer. It can also be raised in other conditions other than the prostate cancer. Thank you very much for listening to me. For any query, you can contact on my WhatsApp number. Best of luck to all of you. Thank you very much. Bye.